My name's Doug Luke, and very privileged to be here today to talk about particularly agent-based modeling and a model that we've been working with for a number of years. I've got really three goals today. I want to talk a little bit about the case for retail tobacco control policies, then talk more generally about the use of agent-based modeling in tobacco control science, and then combine the two and talk about Tobacco Town, which is our agent-based model in retail policy research. I would like to give a shout out. I'm representing a great team. Aspire is advancing science and practice in the retail environment. It's an NCI-funded research center, and we have a number of people here from the team. Lisa Henriksen, Ross Hammond, Maggie Mahoney, I believe, are all here today. So I'm representing them and many others. Aspire, as the name suggests, is focusing on retail tobacco control, and in particular, the role of the built environment in tobacco use and health impacts. So let me say a little bit first about retail environment and policies. We know in tobacco control what works, the classic four-pronged approach around pricing, cessation, smoke-free policies, and media campaigns. One of our colleagues, Amanda Kong, has suggested that retail approaches can act as a vaccine booster, that is, can be a fifth approach to tobacco control. And why do we think that's important? Well, first of all, tobacco retailers are ubiquitous. They're everywhere. You think there's McDonald's everywhere. There's 27 tobacco retailers for every one McDonald's in the US. So they're all around us. Not only are they around us, they're in a lot of different sorts of places. And as many of you know, tobacco products remain the most heavily marketed and advertised product in the world. In fact, in 2018, the tobacco industry spent $1 million an hour at these retail locations, marketing and selling these products. So, and not only are they ubiquitous, but there are really critical inequities in the location of tobacco retailers. And a number of studies and papers and some modeling approaches have looked at a retailer reduction as an appropriate health equity approach. That is, you tend to find tobacco retailers in poor parts of communities. You tend to find them in communities where there are more populations of color, for example. And so retailer-related policies that are effective can also reduce those inequities in our communities. So when we say retail tobacco policies, what are we talking about? Well, communities using tobacco retail licenses to monitor retailers in their community, using license caps to put an upper limit on how many retailers can be in a community, employing retailer buffers, that is, not letting retailers be too close together to reduce or eliminate the kind of retailer packing that we find in many communities. These policies can reduce product availability. So retailer policies can, for example, restrict where menthol products can be purchased. And then there are other kinds of retailer policies that restrict who or when. So for example, tobacco 21 policies that raises the age for legal purchasing. What these policies do, that is how they operate, is when you reduce retailers in a community, you increase the distance to retailers, which means that you increase the distance to products. It takes more time to get to the retailer to purchase those projects. This increases costs, and costs often increase when there are fewer retailers in a community. There's reduced exposure to advertising and also reduced purchase opportunities. And these are you're going to hear me talk about mechanisms in a little bit, but these are the mechanisms by which retail tobacco policies are hypothesized to work in communities. So now let me switch quickly and talk a little bit about agent-based models, because the model that I want to particularly talk about is an example of an agent-based model. As Ken introduced earlier, agent-based models, they're computational simulations, but they take a bottom-up approach to study a complex system. Essentially, these complex systems have individual elements in those systems, and those agents, what we call them, these agents behave as a function of their characteristics and their interactions with each other in the environment. So that's really important. It's those interactions among agents that often turn out to be very critical when we look at ABMs. Thinking about what David just talked about in terms of limitations of compartmental models, agent-based models have nice complementary strengths. In particular, agents themselves can be quite heterogeneous. So that opens up all kinds of types of research questions that might be harder to do in forecasting models or compartmental models. Particularly important for retail tobacco control policy is that ABMs are built with environments. That is, the agents exist within environments, and these environments can be physical environments or social environments. Social environments such as social networks, but physical environments like neighborhoods where people live, where they go to school, where they purchase tobacco products. And essentially, when you use an agent-based model, you're observing how that model works. And as Josh Epstein once said, it helps you focus on the mechanisms of some behavior, or in our case, policy effects. And Josh Epstein one time said, if you don't understand it if you can't build it, meaning if you can't model it, you don't really understand what's going on. Skip that slide. So what goes into an agent-based model? This is based on Russ Hammond. He's put together this system that I think of it as a recipe for an agent-based model. The ingredients that go into an ABM. So the agents themselves have properties. The agents can be people, but they can also be hospitals or businesses. The agents themselves do things. So people might wake up and go to school or go to work. They might purchase tobacco products. And when they have these actions, they follow rules. So for example, when they purchase tobacco products, they might prefer products that are cheaper or closer to where they live. All of this happens over time. And as I already mentioned, within environments, which can be physical, social, or both. Just to add on to what David had already said, Josh Epstein talked about using computational modeling for more than just prediction. Prediction is incredibly important, as we saw particularly from Ken's presentation. But there's many other reasons to do modeling. And for agent-based modeling, I think the most exciting thing for our science is to reveal those underlying mechanisms, those underlying core dynamics, to discover new questions, to discover data gaps, and so on. And many of these are listed here in this slide from Josh. In public health, I'm not going to say too much about this, but agent-based models historically have been used predominantly in the study of infectious diseases, which has been particularly important lately with COVID. But lately, we have seen ABMs be used in other areas, in particular in behavioral prevention studies and in the sort of work I'm most interested in policy research. And so these are in different areas of chronic disease, public health policy, and implementation science as well. And so we see Tobacco Town as an example of an ABM that's particularly useful for public health policy research. To be a little bit more specific here, historically, there have been lots of types of studies you simply can't do in tobacco control. You can't do these traditional, so we can use computational models. We can use these models as virtual laboratories. You model a baseline community, for example, and then you introduce a type of policy and then see what happens to that virtual community. I just mentioned this. One of the things particularly useful for modeling, especially in concert with empirical scientists like epidemiologists, is when you model, you discover data gaps. So even though we have tremendous knowledge about the epidemiology of smoking, we discovered in our Tobacco Town model that we actually didn't know the answer to a pretty simple question, which is how far are people willing to travel to purchase cigarettes? That's something that can be added to the next generation of surveillance research in tobacco. So in my remaining time, what I'd like to do is tie these two things together and say a little bit about a series of models that we've developed over the years called Tobacco Town. And Tobacco Town is sort of just what I suggested. It's using an agent-based model as a policy laboratory to study the potential effects of retail interventions. We have a fairly long history. It surprised me that we've been working on this for almost 10 years. And at each stage, we've gone from fairly simple models to making them slightly more complex. It's still a fairly simple model, but they're all focused on trying to understand how retail policy interventions might actually be working. I think I've mentioned most of this before. The one thing I'll say is, especially in the recent Aspire Tobacco Town, is we've been working very closely with community partners throughout all phases of this project, partly because we want this, well, in general, we want the model to be useful for policymakers in communities around the United States. But particularly, we're gonna, and I'll show you a little bit of this, we're building tailored models that are specific for a city like Washington, DC, or Providence, Rhode Island. So as an example, and you might have missed it in the earlier slide, Tobacco Town is focusing particularly on two kinds of environments, the built environment and the consumer environment. In the built environment, we can examine policies, for example, license caps. Or the example here is on the left-hand side, you see retailers in a community, and there are also schools. If the community passes a policy that restricts tobacco retailers who are too close to schools, and that you see on the right-hand side, what happens to that community environment? In particular, what happens to people who are going around that community and wanting to purchase tobacco products? In the consumer environment, so this is the environment more of what we see when people enter tobacco stores, we can study policies like what happens when minimum price laws are established, or when certain, for example, when menthol products are restricted entirely in the community or possibly to only certain types of stores. So the building blocks of Tobacco Town, it won't surprise any of you. We use a lot of empirical data, smoking characteristics. Important for our model are retailers, the kinds of retailers and where they're located in particular towns. Pricing information, and then the actual rules that underlie the model are based on not just data, but broader sets of literature and theories, especially social science and health science theories. So for example, travel and purchasing theories that suggest that people want to minimize the time they take to purchase commodities like cigarettes. And so what we have here is we get to use real maps of real cities. That way we can, and in particular, we're using a set of national synthetic population data. These are not real people, but they look just like real people. And so we know, for example, where people live in certain cities based on their sociodemographic characteristics. On top of that, we add on things like where are the tobacco retailers in those environments? And that allows us to, in the computer, show people moving from their home to their work every day and then when they need to purchase cigarettes, the route they would take to purchase cigarettes. And typically it's a route that will minimize both time and price. That's the baseline. And then what we do is we add policy interventions. So what would happen when, as we saw before, when retailers can't be too close to schools, then what happens to these individual agent routes that are happening in the model? I'm just going to skip that for time. So, oops. So what are we learning in these Tobacco Town agent-based models? Well, I've listed what I think are the most interesting or compelling or surprising lessons learned from this line of work. The first thing is that when we look at density reduction efforts, it's not, the effects are not linear. And I'll show you what I mean by that in a sec. Consistent with decades of tobacco control policy research, we find that strong policies and multiple policies have larger effects, that any individual policy is never going to be enough. Intriguingly, and this is something I think is a particular strength of ABM's, are the policy effects are community specific. What works in Providence may not work or may not work the same way in New York City, for example. And different kinds of policies work in different ways. And that means they have different potentials for affecting disparities in behavior. And then finally, and I'll show you a slide on this, what we're learning is that retailer density and resident and proximity to retailers are not the same thing, even though they're highly related to one another. So as an example of one of these, this shows retailer density in different kinds of communities. And then on the y-axis, we see an abstract cost estimate that combines time and money. And what you see is we don't really see a large effect on cost until density is driven down pretty low. And what this means for example, in high density urban environments is, you really have to reduce density quite dramatically. And in fact, the policies, they may not be feasible to pass to get density low enough where residents essentially notice it. They notice they have to travel further, or they notice that they have to spend more money. The second thing, this is probably going to be a little hard to see on the screen, but the columns here are different kinds of communities. And then the dots are retailer density. And what we see is retailer density starts out quite differently. This is the inequities that I talked about. And as you look at different kinds of policies and start layering on the policies, we get to a point where we can both lower retailer density and reduce the disparities across community type. And then more recently, we've been focusing quite a bit on this. And so this is pretty new from our Tobacco Town models. Density and proximity are not the same. So what do we mean by that? Well, here is Providence, Rhode Island, and the red dots are where our current retailers. And what we find in Providence is there's almost 10 retailers per square mile. Now, the next two pictures are two different policies. And before I explain the policies, notice that both these policies reduce density about the same, to around 2 retailers per square mile. So one policy is a retailer to retailer policy where retailers are not allowed to be within 2 kilometers of each other. The next policy is a school policy where retailers are not allowed to be within 2 kilometers of a school. Even though they reduce density about the same, they have very different effects on proximity. The proximity is about 1/4 of a mile in the retailer policy and almost 1/2 a mile in the school policy. And if you look closely at the map, the school-based policy clears out the tobacco swamps in entire neighborhoods. So you see this whole area of Providence doesn't have any retailers, whereas the retailer policy, retailers are still pretty evenly distributed to throughout the community. This is really important for policymakers. We think by revealing this kind of underlying mechanism, policymakers can design policies that work best for their particular communities. And I think pretty much out of time. So let me just say one more thing and then close. We have been, as I mentioned before, we've been working with community partners throughout this project, and we're particularly excited about using the Tobacco Town model to answer questions for particular communities. And so we've created a dashboard that's available that allows community policymakers to explore potential effects of these different sorts of retailer policies and see which ones affect density and proximity, or which ones have the greatest potential for disparities reduction. And we're really excited about continuing to roll this out, especially for community policymakers. So the main early conclusions from our Tobacco Town models, I've mentioned most of these, but just to land on what we think we're most excited about. Policies, the mechanisms and their effects are community specific. Community engagement is very important and really supported by good agent-based modeling, where the communities themselves have input into the model building, testing, and hopefully implementation and sustainment over time. I've already mentioned the focus on mechanisms, which helps us understand the architecture for tailored design of policies. And then because of these focus on mechanisms and the ability to view policy effects in community-specific contexts, I think ABMs hold really critical promise for studying the rise and fall of tobacco-related disparities. So I'm gonna end there, and here's some contact information if people wanna get in touch.
Thank you, Dr. Lip, that was great. And it's really exciting to see the results from Tobacco Town. I think there's time for a quick question before we take a short break. One is like you talked a little bit about tailoring the models, and I think Dr. Mendes also mentioned that we need I guess the new problems might need new models. So the challenge there is, for instance, how do you think about or what are the things that are needed, for instance, to be able to rapidly and effectively, without necessarily having to start from scratch, go from a model for Rhode Island to having models, let's say, for all potential localities that might be interested. So I don't know if you have quick comments on that. Well,
you may want to follow up with that question with my friend and colleague, Ross Hammond. I know he's thought a lot about this. I think, by tailoring, I think there's a balance here. Sometimes you have a model that's a generic model that is just meant to be widely applicable. Other times you might build from the ground up a specific model for a particular context. I think in Tobacco Town, what we've tried to do is have a little bit of a balance there. So certainly the first version of Tobacco Town only used abstracted town types, poor urban, poor suburban, rich suburban, and so on. Using the basic framework though, the key for us for tailoring, it wasn't all that complicated. It's moving to geophysical data, i.e. maps for real towns, and then these synthetic populations that allow us to put people in realistic places on these maps. And then the third ingredient, and most critical for us, is through Aspire, we have good data on where the retailers are located. So as soon as we have those three things, I'm not saying it's easy, but we're able to look at how Tobacco Town is working for a specific town. So I don't know if that helps, but that's.
Yeah, I think it's worth thinking about that. Like in some ways, it's a little bit like, how do we up our game so we can do things in that more dynamic, rapid way, using technology and all the tools that we have available. Andy Highland has his hand raised. So, yeah, could you ask your question?
Yeah, I do. Yeah, hi Luke, Andy Highland here. Great presentation. I love the agent-based modeling. I've never used it, but it just feels like a very flexible approach. My question, which I've always had, is how, like the inputs that go into it. Luke, you referred to basically kind of theoretically based kinds of assumptions, I guess, that are pulled together. And if it were only that simple, Mitch, we already would have the nicotine standard if it was based on the, this theory-based assumption. So how do you model the sensitivity around those model assumptions, and whatever else you can say about those inputs?
Yeah, great question, and probably the thing that I've learned the most about, in doing this work. What I would say is agent-based models run the range of highly abstract models to highly empirically based models. And there are good and bad models of each kind. And there have been highly, in the social sciences for sure, and I think a little bit in the health sciences, there have been highly influential ABMs that are pretty abstract, that again, for example, reveal a dynamic that we didn't understand earlier, let's say. The other side of this is, I think it is important to have these models be empirically based, especially in public health, where we're studying, ultimately real policies that will be implemented in real places. That being said, go back, I think Ken pointed this out and then David re-emphasized it. These models, notice I didn't say forecasting or population risk or national cancer rates anywhere in my presentation, because Tobacco Town is not about that. And so the agent-based model will be focused on answering a particular kind of question. And in some of my doctoral classes, we talk about different models of hearts that are used. The kind of model of a heart that a surgeon needs is different from the kind of model that I don't know, a romance novelist would need. I mean, that's a joke, but the point is, what you do is, if you're clear on what the model is meant to do, that then leads to, okay, which data do we really need for this? And just as a reverse example, this is a transportation model in terms of the physical environment. And so for us, we actually want to know how far people actually travel typically for purchasing tobacco products. And that's been hard for us to get at. Now we're hoping through Aspire and others that this will be added to other data sets. But there, for example, we are doing much more sensitivity analyses because we don't have those good estimates for that particular piece of information.
Thank you. Thank you for the question and for the excellent talk. I think maybe one thing that will be coming back to it is that need for those who are collecting data, who are not necessarily modelers, to really have these conversations with the modelers, so that we can actually provide input in terms of what is the data that would be great for us to be able to have to inform our models, which in the end will make the usefulness of that collected data probably much bigger, right?